I am Myla Joy C. Cantoja, a first-year nursing student at Central Mindanao University. Today, I am going to demonstrate the procedure for donning and removing sterile gloves open method. Before we start with the procedure, we need to do an assessment to check the current record of the patient and to know whether the procedure requires the use of gloves and ask the patient if he or she have latex allergies. The possible nursing diagnosis is the response in latex allergy and risk for ineffective protection. The materials needed for this activity is a package of sterile gloves, an alcohol-based hand rub, or you can just wash your hands before you do the procedure. Since we're all set, let's do the procedure. Procedure number 1. Perform hand hygiene and put on PPE if indicated. This prevents the spreading of microorganisms. You can wash your hands or you can use alcohol-based hand rub. For procedure number 2, identify the patient, explain the procedure to the patient. Patient identification validates the patient and the procedure. Explanation of procedure helps in reducing the anxiety of the patient. For procedure number 3, check that the sterile glove package is dry and unopened. Also note the expiration date, making sure that the date is still valid. So here, the moisture contaminates the package, so you need to make sure of it. So for procedure number 4, place sterile glove package on clean, dry surface or above your waist. Any sterile objects held between the waist will be considered as sterile. For procedure number 5, open the outside wrapper by carefully peeling the top layer back. Remove your inner package, handling only the outside of it. So this maintains the sterility of the gloves. So here, so you will now open it. There's this. Yep. For procedure number 6, place the inner package on the work surface with a side label, cuff end to the closer to the body. Left cuff. It allows for ease of your glove application. So now we will open it. Hold on the sides. That. Open. So, with the thumb and forefinger of the non-dominant hand, grasp the folded cuff of the glove for the dominant hand, touching only the exposed inside of the glove after opening this one. So, when opening this one, I'm going to use these 2 fingers, like this one, grabbing here. Careful not to touch the inside, and open. So we have 2 inches for us to hold here. So when the paper crumples, it's okay. So we need to, yeah. So now that the gloves is open, careful not to touch. So I'm gonna perform the procedure number 9. And for the procedure number 10, keeping the hands above the waistline, lift and hold the glove up and off the inner package with fingers down. Be careful it does not touch any unsterile object. The glove is contaminated if it touches any unsterile object. Procedure number 10, carefully insert dominant hand palm up into the glove and pull glove on. Leave the cuff folded until the opposite hand is gloved. Attempting to turn upward with a sterile hand may result in contamination of the sterile glove. So we will now insert our hands. You need to fold your thumb, so that will be easier for you to let it. Okay, doing good so far. Okay. Not touch me. Okay. For the 11th step, we need to put our non-dominant hand into the gloves. So use your 2 fingers to lift the outside, touch only the outside part of the gloves. So like this one. like that, and adjust. Don't touch the inside of the gloves because you're going to contaminate it. Same for the other side. So you can do it like this to adjust the gloves. So for step number 12, slide the fingers of one hand under the cuff of the other hand, fully extended, and the cuff down the arms, touching only the sterile outside of the glove. Repeat for the remaining hand. Yeah. So number 14, adjust gloves on both hands if necessary, touching only sterile areas with other sterile areas. And for the last step, continue with procedure as indicated. So that's it. Removing soiled gloves. So this is how you do it. Use dominant hand to grasp the opposite glove near cuff and on the outside exposed area. Remove it by pulling it off, inverting it as it is pulled, keeping the contaminated area on the inside, holding the removed glove in the remaining glove hand. The contaminated area should not touch the hands or wrists. So this is my dominant hand. I'm gonna do it like this one. I need to pinch it. Harder. Like that. Let's go. Then after that, you need to put it in your hand and crumple it. So for the other hand, you need to slide fingers of ungloved hand between the remaining glove and the wrist. Take care to avoid touching the outside surface of the glove. Remove it by pulling it off, inverting it as it is pulled, keeping the contaminated area on the inside and securing the first glove inside the second. The contaminated area should not touch the hands or wrists. So let's do it like this one. This one. Do it like this one. And now we're going to discard the gloves in appropriate container. And if you're wearing any PPE, you can remove it now. And after disposing it, you should perform hand hygiene. It reduces risk for infection transmission and contamination of other items. And we're done.